So I wanted to make this quick video because basically I'm in the hospital. This is post LEEP surgery, and I've had a LEEP before. I had a LEEP in 2017 and my LEEP was fine. And each time, because of lupus and my medical history, when I have a LEEP surgery, I have to go under an anesthesia. So I am consciously sedated, and then they do my LEEP because of all the things that I've had going on, all the surgery I've already had. So I've never had it done in the office. So if you have that option, I would say definitely go for that option, because you don't have to go through like the lidocaine of them numbing it. You are half asleep or all the way asleep, and then they do what they got to do. So when you wake up, they give you pain medicine and everything like that, so you're okay. So I prefer that way. If that is an option for you, ask your doctor. If it's not, I've heard the other way isn't so bad for some people. It sounds way more painful for me. I've watched videos of what they actually do, because they're taking off the part of your cervix that has the abnormal or cancerous cells. So and they're using a heated metal tool to do it. People say they don't feel pain, but like, I don't know about that. When watching it, looks like, I don't know. If you are numb, so I mean, I'm sure you don't feel it. If your doctor numbs you up really well, I'm sure you're good to go. I've had lidocaine before just for other procedures, and I don't like the feeling of lidocaine. It is a minute, like it stings just for a little bit and then it numbs it up, but I tend to need a lot of lidocaine, so I don't know. I just would prefer, if you have the option to not do that, I would just not do it. I would just do the one where they put you to sleep. So my first experience with it wasn't bad. They put me to sleep. I did have some like cramping and bleeding afterwards. It lasted for about a week or two, and then those symptoms started to subside and I was good to go. You can't have anything up there like tampons or any sex or anything for 4 weeks total, 3 to 4 weeks, depending upon your body and what your doctor says. I waited 4 weeks because I wasn't feeling good about having anything up there anyways. But this time around is a little different for me, and this is probably due to my autoimmune again. So lupus always makes things a little bit more difficult, guys. So lupus and LEEP. So this time they took me in. I had my procedure. Everything was fine. After I woke up, I did feel a little bit of burning around the area that they cut. Right after, they gave me pain medicine right away. It was in my IV, so I didn't feel anything. When I got home, I was fine. I was still drowsy and stuff from the anesthesia and the pain meds. So I had my procedure on a Friday. Saturday, I was okay. Sunday, I did feel some symptoms. I started to have a fever, and I started to have pain. So this time around was a little different from me. The following week of my surgery, I was having pain when I peed. I was very tender down there, swollen, and wasn't sure what was going on. So I did call my doctor. I had a follow up with her the Thursday after my surgery. Again, my surgery was on Friday. I had to follow up with her on Thursday. It was still very tender. She tried to do a pelvic exam. I was crying like a baby, guys. Like, wasn't sure what was going on. I found out that I was having some discharge. The discharge was prior to my surgery. Wasn't sure what it was from, but they didn't want to treat it because I am allergic to a lot of things given my history. They didn't want to treat it right then, especially with having the procedure. So she did give me an antibiotic, but she gave me a vaginal cream to put up there, which again, the discharge instructions say you're not supposed to put anything up there for 4 weeks. But my doctor said it would be okay because we wanted to treat the pain that I was having. And the pain is very severe, guys. Like when I pee, I'm like clenching, like, again, like one of my previous videos when I had the fistula. So she gave me the cream, and I took the cream for about 3 days, and then I had like an outbreak of like a rash down there and still having pain. So I decided on Monday to come into the emergency room because my doctor had gone on vacation and she was going to follow up with me after vacation. I also was set to go on vacation to go visit my mom. I wanted to go visit my mom, but I figured before I go on my vacation, let me just go see if I. So, anyways, I was supposed to go in just to get pain meds, and I'm here. So, guys, I've been here since Monday. It is now Wednesday. They wanted to treat me. Usually with lupus patients, what happens is either they want you to wait to see your doctor, so they send you home with pain meds, or they want to hold you so that they can observe and treat you and see what's going on, and they don't feel comfortable letting you go. So I was admitted to the hospital, and they treated me with a couple of IV antibiotics to see if it would help with the pain, with the discharge, and the rash area. So as of now, sorry guys, I had some people come in, but now I'm back by myself. Okay, so as of now, I'm in here. They've run some tests. They took cultures of the rash area. They tried to take cultures of the inside. I told you when I went to visit my doctor on the Thursday, she tried to do that as well. And just going in there is just too painful right now. So they have to reduce the swelling and see if they can get that down before they can really go in and do any kind of vaginal exam. So really they're just treating me with antibiotics in hopes that I get better. Right now, 3 days in, I still am having pain during urination, but they're hoping that they can discharge me and treat me from home, and I will keep you guys updated. But this is all probably because, you know, I just have so many things going on with the lupus. Like I said, whenever you have other things, lupus just is not a contributor. Like, you have to factor in your lupus and that you don't heal as much as other people, or don't heal as well as other people. Most people have normal, most women will get, you know, have their pap smear and get diagnosed with the abnormal cells at least once in their life, have to go through a cystoscopy, and then it just kind of goes away. Every year I have my pap, I get diagnosed with abnormal cells. I've had about 4 or 5 cystoscopies right now. They are not pleasant. You can look them up. If they basically biopsy the inside, the part that they say, the cells that they say are abnormal. So they scrape a little piece of the inside, and it's always painful for me every time they do it. So I don't know, guys. You're your own gauger of pain, but it always hurts for me. They don't know me or anything. They just kind of do it. It's an in-office thing. So, but so once they do that, they tell you if they, you know, if you're good to go. If they didn't find, if they find something more, they decide to do a LEEP. So that's where I am right now. Again, this is my second one. I will keep you guys updated if I get discharged, or if things get better, or what happens. So, see you soon. So just to clarify, I had my LEEP surgery on the 19th. I was having pain and complications the whole time until the 29th, when I decided to go into the hospital for some pain meds before I traveled. They admitted me, and here we are now. So happy day. They are going to discharge me. I'm not 100% better, but they're going to treat me from home. They're going to give me the antibiotics orally and just let me take them at home and monitor me, and I'll see my doctor when I get back. So I'm getting discharged, but I'm gonna follow up with you guys when I get home, because the pain's still not gone all the way. I mean, I feel a little better, but I'm still having pain during urination and stuff. So I definitely will follow up and let you guys know what happens next. See ya. So to catch you up, I was discharged. I consulted with my doctor, who told me I should continue to go on my trip because family would be good for me. So I flew to Miami. I was very safe. Got to see my family, which I loved. And family is a healer. It makes you feel all better. And I got to enjoy fun in the sun. I got to take pictures and I got to go to the beach. Until next time, guys. See ya.